The Aptus Helifix system is intended to provide fixation and sealing between endovascular aortic grafts and the native artery. The Helifix system is indicated for use in patients whose endovascular grafts have exhibited migration or endoleak, or are at risk of such complications, in whom augmented radial fixation and/or sealing is required to regain or maintain adequate aneurysm exclusion. Refer to the Helifix Instructions for Use for complete indications, contraindications, endograft compatibility, warnings, and precautions. The specific patient experience illustrated in this video relates one individual's outcomes after treatment. The events and outcomes described are genuine and documented. Treatment of endoleaks with EndoAnchors represents a typical use of the device. However, not all patients will be candidates for use of the Helifix system. For patients who are candidates, this specific case does not provide any indication, guide, warranty, or guarantee of outcomes. Not every outcome is the same. For other individuals, outcomes could be different, as they can and do vary. EndoAnchors may not provide definitive resolution of endoleaks in all cases, and long-term follow-up is required after treatment. Patients should consult their physicians regarding the potential risks and benefits of various treatment options.
My name is Brad Mills, and I live in Greenwich, Connecticut with my wife, Patricia. I've always been healthy. I have no history of heart disease. Every time I had a checkup, I came out perfect. I woke up that morning and it was just a wonderful day. I thought it would be great. I sat down at the computer and I got this pain in my back. It was really hurting. I walked down into the family room. The pain was just awful, and I just said to my wife, I'm going to pass out. And fortunately, I passed out right into the chair. The next thing I remember was being in the emergency room at the hospital and a woman telling me that, Mr. Mills, you have a ruptured aorta. It's very serious, and we're going to bring the family in to talk to you.
Mr. Mills initially presented with a ruptured aneurysm, which is a nearly fatal event to his local community hospital. An aortic aneurysm is essentially a ballooning out of the aorta. In Mr. Mills' case, his aneurysm had ballooned out such it was about twice as large as a Coke can, so significantly larger. And just like a balloon that expands, as it gets to a certain point, that balloon will rupture. And in Mr. Mills' case, his aneurysm got to a certain point at which it ruptured.
At the community hospital, the vascular surgeons were able to put a stent into me. And that stopped the bleeding for the moment, and they thought that this would be a permanent fix.
The physicians there were able to temporarily seal the hole in his aorta and save his life. And that lasted for a few days. He started bleeding again, and the hole in his aorta was untreated. An endoleak left alone ultimately means that the endovascular repair of the aneurysm is not successful. Blood is flowing around the outside of the endograft into the aneurysm, and in Mr. Mills' case, out the hole in the ruptured aorta, and he continues to bleed. He was transferred here to Yale New Haven Hospital, where myself and Dr. Aruni took care of him using a novel technique.
Many patients present to the emergency room just as Mr. Mills did, with a ruptured aneurysm, which is a catastrophic event that potentially could have been prevented with appropriate screening with ultrasound, which is totally painless and easy to perform.
I talked to Mr. Mills about using this technique. We brought him to this very room, and under local anesthesia, meaning we didn't even put him to sleep, we were able to access his aorta, find the hole, find the leak, treat the leak using an EndoAnchor, essentially seal off the bleeding.
I was thunderstruck when I got out of the operation. I was conscious most of the time, and I went into the recovery room there, and I was talking, felt fine, no pain at all, and very little as far as sedation or anything. It was incredible. And they put about 10 of these helical anchors in me.
The EndoAnchor system is essentially a catheter that has a mechanism to deliver an EndoAnchor. It is a spiral-shaped metallic device that acts as a rivet, essentially riveting or bolting the stent graft to the aortic wall, and allows for technical success.
After this event, I've recovered to the point where I'm just as healthy as I was before. I'm with my family, all my grandchildren. It's really great.
His CAT scans demonstrate that his aneurysm is successfully fixed, these EndoAnchors are durable, and he is successfully treated. You never would have known that a year and a half ago he was so near death, and he looks so good now.
Dr. Bart Moose holds the position of Chief Medical Officer with Aptus Endosystems, in addition to his clinical and academic roles with Yale New Haven Medical Center. Mr. Brad Mills and Dr. John Aruni are not employees or consultants of Aptus Endosystems and did not receive compensation for their participation in this video.